part 4 about the pharmacokinetics and the absorption of medications. The session learning objectives, we cover the learning objective 1, 2, 3, 4, 5 in the first 3 videos. And here we are going to compare and contrast the drug names based on the chemical and generic brand names. And also we are going to cover the first pass metabolism, bioavailability. So these up to absorption and route of administration, we cover the videos from the part 1 to 3. So first pass metabolism and bioavailability and plasma drug concentration curves, drug names, summary. So we are going to cover these parts in this video. Right. So first one, the first pass metabolism. So that means which is a crossing the first, right? So when you take the medication, so for example, the medication is a here that crosses this enterocytes, then goes to the portal circulation, right? So while crossing this, there is some enzymes present here. So these enzymes, they metabolize these medications. That is called first pass metabolism. So what's the problem? So that means you are going to expect less amount of drug reaching the systemic circulation. So this is a mainly, we call it as a pre-systemic elimination before reaching the systemic circulation. And this applies mainly to the oral route of administration. And the major site for the first pass metabolism, that is the liver. So liver have a lot of drug metabolizing enzymes. And also other minor sites like intestinal, enterocytes, stomach, and the lungs, other minor sites. So what's the mechanism? So that means that drugs absorbed beyond the oral cavity are transported to the liver via portal circulation. Because while crossing these membranes or the enterocytes, hepatocytes, portal circulation, so there is a metabolism of drugs by various enzymes. So then the only few active metabolite reaches the systemic circulation. So this process known as first pass effect. What is the consequence? So there is a loss of some active medication. So that means decrease bioavailability and increase first pass metabolism. So both are inversely proportional. If you increase first pass, you are going to decrease the bioavailability. So medications with the high first pass metabolism like lidocaine, albuterol, nitrates, propranolol, verapamil. So these medications, when you take orally, so there is an increase of first pass metabolism. So that is why you have to choose other than oral, like parenteral or albuterol we give by inhalation. If you want to give oral route, so you need to increase the dose to compensate the loss in the first pass metabolism. And also high lipid soluble drugs have most first pass metabolism because it is easily extracted by liver. So what are the other routes they reduce? They bypass the first pass metabolism, like all the intra parenteral route like IV, IM, subcutaneous, inhalational route. While giving medication by sublingual, we know that that directly enters into systemic circulation via superior vena cava. So less medication is metabolized by first pass. So like sublingual nitroglycerin is a good example. And rectal route, especially when you inject, when you place the suppositories at the lower part of the rectum, that is a mainly inferior hemorrhoidal veins. So less first pass metabolism, more medication enters the systemic circulation. So less first pass metabolism. Whereas transdermal routes also drains directly into the systemic circulation. So bypasses the liver. So that is also having so less first pass metabolism. So, and also there is another important concept here because we are covering the Hepatic and intestinal connection, there is a entero means intestine, hepatic, liver. So cycling. So some medications after conjugation, they deliver into the intestine. Here we have the gut microbiome, so that deconjugate the metabolites, then again they are like freely reabsorbed into the portal circulation. That is called enterohepatic cycling. Especially the drug metabolites, they are more than 300 molecular weight. They excreted in the bile and stored in the gallbladder, delivered to intestines, deconjugated by intestinal bacteria, reabsorbed into hepatic portal circulation. So in that condition, if some patients, if they take antibiotics along with these medications, you are going to decrease the intestinal bacterial flora. So you are going to decrease the enterohepatic cycling. Example like oral contraceptive pills combined with antibiotics, you are going to reduce the effectiveness of oral contraceptive pills. You have to choose the other contraceptive method. All right. Next one. So just recollect the application, how we can apply this first pass metabolism. All right. So a drug bypasses the first pass metabolism when administered by which of the following? All right. So pause the video, come up with the correct answer. So drug bypasses the first pass metabolism. So that is when administered which of the following routes? All right, I think you got the correct answer, right? So the correct answer is all of the above. Inhalation, sublingual, intravenous, rectal routes, they bypasses the liver, so they have less first pass metabolism. The next concept is the bioavailability. So we know that bio means life, living. So we are talking about medications, pharmacology, right? So that means the how much active medication is available, right? In the where you need to available in the systemic circulation, the active form, right? So this is usually we denoted in the F fraction. Okay, so F is the fraction, that is a bioavailability. The fraction of extent of the which of the dose of the drug reaches the site of action, biological fluid or systemic circulation in unchanged form, that is active form, accessible to produce the response. So usually IV routes, we are giving entire medication into the systemic circulation. That fraction is 100% medication in the circulation. That is of F value is 1. Whereas oral and other routes, the bioavailability F value is less than 1. Okay, because there is a first pass metabolism. So F, if it is a 0.5 means that is a 50%. Okay. All right. So here if you see the graph, the x-axis is the time after drug administration. Always when you give the oral route of administration, this is the y-axis, the plasma concentration. So it slowly absorbs, right? So it reaches the maximum concentration. So this is absorption phase, right? Then it distributes into various bodies, correct? So that is a distribution phase. Then you see the plasma concentration slowly decreasing. That means there is a metabolism phase. Then the plasma concentration significantly decreased, then that is the excretion elimination pathway. That is the pharmacokinetics. Absorption reaches maximum concentration, distribution, then metabolism, then elimination or excretion. So this concentration, the amount of drug present in the body, that is we call it as area under curve oral route of administration. When you compare the IV administration, we start with 100% that present in the body, right? So then it is slowly distributing, metabolism, elimination, like that. So that's what you can. So this curve represents the area under curve for IV route. So that is what the F value calculation, it is equal to area under curve oral or comparing IV route. Any route to compare the bioavailability, you have to compare IV, right? So next one, what are the factors affecting the bioavailability? All right, so we know that there is a first one, pharmaceutical. That means the route of administration. So we know that IV route 100% and also the rate of extent because the oral form, some the tablets, the capsules, they have different types of disintegration because the tablet contain a lot of excipients, so hardness, right, and coating. So depends on disintegration, the bioavailability will varies. Okay, so if the drug is a faster disintegration, for example, gels, what liquid forms, they're rapid dissolution, so more bioavailable. So less dissolution, so less bioavailable. Distribution, for example, the drug is a highly lipophilic, crosses the membrane, rapid distribution. That increases the bioavailability. Biological factors, the effect of food. For example, if you have increased the lipophilic drugs, if you taken with the fatty food, then it increases the bioavailability. For example, griseofulvin antifungal, it needs the lipid food to enhance absorption. Whereas iron, you need the acidic food to increase absorption, right? So whereas some medications like tetracyclines, they decrease the bioavailability by mixing with the calcium, like milk or yogurt. You combine with tetracycline, you are going to decrease the tetracycline absorption, right? So whereas a gastric acid, like some of the peptides like insulin, you cannot give by gastric acid, it is degraded by gastric acid, right? Some acid labile substances, these are degraded by gastric acid, like a penicillin and insulin not absorbed in the stomach, you have to give parenteral route. So there is a mnemonic called a city needs acid. Some medications, they need acid, you have to take empty stomach, like some of the azoles, like proton pump inhibitors like pantoprazole, esomeprazole, calcium, iron, thyroid hormones. You have to take empty stomach. So nice mnemonic to remember. A city needs acid. A for azoles, proton pump inhibitors like pantoprazole, omeprazole. C for calcium, and I for iron, and T for thyroid hormones. Right? And also the gut and liver enzymes. So the liver enzymes, they metabolize, so that leads to high first pass metabolism, so that decreases the bioavailability. So P glycoprotein, that is a flex pump. So this affects the lot of chemicals, xenobiotics from the absorption, that may decrease the bioavailability. All right. So now you can compare and contrast which routes of administration have highest bioavailability and what are the characteristics. So we know that intravenous 100% bioavailability, more rapid onset, whereas all other routes, they have less bioavailability. So after intravenous, more bioavailability is the intramuscular, subcutaneous, then in and transdermal, whereas rectal route you can see 30%. So remaining inhalation and oral, they have some significant first pass metabolism. So let's briefly talk about different types of plasma concentration curves, drug concentration. We frequently use these terminologies when you see any drug label information, they have pharmacokinetic parameters, right? Like Cmax and Tmax, minimum effective concentration, onset of action, duration of action, right? So when you see the graphs, you can appreciate the route of administration, right? So the y-axis, you count plasma concentration, the x-axis is the time. So intravenous means it starts from 100% and slowly metabolized and excreted, whereas intramuscular, so it may have some absorption, whereas subcutaneous, some absorption, oral, you have absorption, whereas intravenous, there is no absorption. And when you analyze the plasma drug concentration curves, the x-axis is the time and y-axis is the plasma concentration. So you can see if you take a pill, it starts absorbing and increasing the concentration. So this is the minimum effective concentration. For example, the medication reaches 15 milligrams per ml, that produces, for example, you take a pill for headache, so it start producing, relieving the headache at the dose of E. That is the minimum effective. Then it reaches the maximum concentration, that is the Cmax. then it is metabolized and start eliminating, and up to here, so between 10.5 up to like a 28 milligrams, this is a therapeutic window. So here you are getting the relief of the uh, headache. So that is analgesic effect, right? Then once it is below the like 15 milligrams, then you don't have any response, so it is slowly eliminated from the body. So from here to here, that is the duration of action of the medication. So this one is the onset of action. The drug start producing response at the 1 hour, right? And duration approximately 1, 2, 3, 4, 5.5 hours is the duration of action. Okay. And so here after 6.5 hours, the no response. Okay. So what is the maximum? T max. So what is the Cmax? Concentration maximum. Tmax means time at which the Cmax occurs. So what is the number? 3 hours is the Tmax. All right. And let's talk about the drug names. So for the board exams and your assessments, we always you have to remember only generic name. Okay. So generic names means official name. Every country they have like pharmacopoeia. For example, United States, we have United States Pharmacopoeia, Indian Pharmacopoeia, British Pharmacopoeia. That is the official uh, book that we contain the standard medications, their purities, their chemical properties, pharmacological properties. Acetaminophen is the generic name, so that can be prepared by various companies. Then they give the brand name. For example, acetaminophen available as a Tylenol is a brand name that is registered by one company, right? That is called brand name or trade name. And chemical name means, so that's what's the chemical nature of this acetaminophen? That is a N4 hydroxyphenyl acetamide. So that is the chemical name, right? So what is easy to remember? Usually attractive names like brand names are easy to remember, but the generic names is the thing you have to remember for your boards and for assessments. All right. And also the brand names we also known as proprietary name, because the proprietor means there is a owner for this company, like proprietor. Okay, so whereas a generic name and chemical name, these are non-proprietary. There is no proprietor, correct? So generic means non-proprietary. All right, so when you see another example, chemical name and generic name metoprolol, this is a chemical name for the metoprolol, whereas a trade name low-pressor. Sometimes the trade name gives some meaning. So we know that this is a beta blocker. So low pressure, pressure means pressure. So that means metoprolol going to reduce the pressure, that is the blood pressure. All right, and also it looks fancy and also gives some meaning. If you take another example, diphenhydramine. So this is most common when you go to the any supermarket. You can see all these OTC medications. Diphenhydramine is antihistamine, and also it is very attractive, different colors. Like they provide like comfort or sleep aid. Like you can see the Curious George nicely sleeping here. And right, so let's take a quiz. Benadryl is correctly described by which of the following? Brand name, chemical name, generic name, non-proprietary name. So what do you think? The correct answer is brand name, right? So Benadryl is the brand name or proprietary name. It's not a chemical name. It's not a generic name. Generic name is diphenhydramine, and also it is a proprietary name, correct? So not non-proprietary. All right. In the summary, in the last 4 videos, we covered how to remember pharmacology, how to approach the pharmacology, and also we covered two major divisions like pharmacokinetics, pharmacodynamics. We know that kinesis means movement in the body, absorption, distribution, metabolism, excretion. Pharmacodynamics means action, mechanism of action, adverse effects, receptors, enzymes, cellular targets. And also we cover sources of drugs, various sources from the plants, microbes, animal tissue, minerals, synthetic. And also we discussed about the various dosage forms, and also we discussed the route of administration, and also we discussed the bioavailability, first pass metabolism, and also we discussed the drug names. All right, wish you all the best. These are the references. See you next time. Thank you.